Today is a lot of information thrown at people very quickly. So I'm hoping that whatever it is you are here for, it's something that is driven by passion. That's what brought me to the school in the first place. I have been in the health and fitness industry for over 13 years now. I started very, very shortly, believe it or not, in high school. When I started after grade 10, 11, I started getting into the fitness industry. And I became a competitive athlete myself. And I would train and I would train, and I would wonder why there was a ceiling for myself of A, injury, B, ability. And I was always battling some kind of health-related issue, whether it be a digestive thing for pushing myself too much. And I always wanted to know what was missing in this, because I can exercise all I want. You can run on a treadmill 5 hours a day. It doesn't mean that it's automatically beneficial just because you're exercising. So my curiosity guided me down the path of higher learning, and I wanted to start researching nutrition. And then one day, when I was at a crossroads with my career and my life, my now fiance, at the time girlfriend, said, "Why don't you become a nutritionist? People ask you these things all the time anyways. Why don't you actually become someone who can make a living out of this?" And I sat there and I was like, that's the best idea I've heard in a long time. So I came to one of these open houses. I showed up at 2:45 in the PM, so the last lecture was done, and I met every wonderful human being that you would meet, that is here today who had been involved with the school at that time, and I was catered to. The questions that I asked were nurtured with true understanding and desire to help me, rather than, oh yeah, here's some information, here's that. The experience itself was what sold me on the school. And lo and behold, I think it was a good decision and life plan for me, because now I'm able to run my own business doing something that I absolutely love. So I get up every day not thinking, oh God, not another day of work, but what can I do to help someone today? So I'm hoping, and you guys are gonna have to help me out, because I wanna know a little bit about what you are here for, that I can give you some knowledge that will A, satisfy a curiosity that brought you here to this talk today, and B, hopefully get you guys all down on the path of helping people in the future, if that's what you're here for. So I wanna take 4 or 5 quick questions. Why are we here today for blood pressure? It can be anyone. Specifically, is there a condition or someone you know, family member, friend, personal thing you don't have to share if details, but I'd like to know why blood pressure. What about it intrigues anyone?
My mom has.
And is she managing it right now with her health? Okay, but you're looking to maybe enhance that for her, I'd assume.
I want to learn more about that.
More about that, okay, good. Anyone else? Or, yes. Okay, so we'll go here, then right there.
I have an elderly person in my family, 85 years old. She's in a constant state of inflammation. Her body's constantly inflamed, and her legs are hurting her tremendously. She doesn't know why, and she has severely high blood pressure.
Okay.
And I'm just trying to make it find some use for her.
There might be some information in here that could supplement her situation. Again, it sounds like there's a lot going on, but hopefully some of the information today could be beneficial to that person.
My mom is also alone. She has high blood pressure. She needs to be taking more pills. I will find something else.
Well, there's 2 worlds, right? There's the traditional medical world, which without that, we would be in trouble. We're trying to enhance the body's own ability to regenerate, and sometimes there are situations where you cannot avoid taking medications, but there are also some things you can do from a lifestyle perspective that could really help, A, prevent, or B, reduce the severity of what someone might be experiencing. So hopefully we can address that as well. Prevention, yes. With blood pressure, prevention and treatment, if you look at it abstractly, are almost one and the same, because it's really about a shift in lifestyle and an understanding of what you need to do to set yourself up for success in the future. So I always like to start my presentations like a story, a once upon a time thing, because it gives you a background. We are currently at the once upon a time because you need to know what high blood pressure is to really know what to do about it and how it affects the body. So definition, the pressure of the blood in the circulatory system, often measured for diagnosis, since it's closely related to the force and rate of the heartbeat and the diameter and elasticity of the arterial walls. Can we dim the lights? That's a great, we cannot, because we have photography and cameras today, and apparently I don't look as good in dim light. So they say. So theoretically we're seeing, say imagine this is an artery, there's fluid flowing in one direction, which exerts an effect, a force, a shearing force more specifically on the arteries. We have a normal pressure, that's good. We have a measurement which I'll share with you, that's an ideal. High blood pressure is when this force interacts with this one in a negative consequence and causes potential damage to the lining of the arteries. We use blood pressure as a vital sign. Every movie I've ever thought about with an intense ER situation, patient's blood pressure is blah, blah, blah over. So it's a principal vital sign to determine, yes, we are in fact alive and how close are we to either optimal health or, unfortunately, the other side. It's an indicator of health status. We will learn that blood pressure is very closely tied to other cardiovascular risk factors and potential cardiovascular diseases. And it's a predictor of specific disease states that also fall under the umbrella of cardiovascular health as a whole. So we measure it in millimeters of mercury. So whenever you see a number 120/80 is said to be ideal, you're going to find out what those mean. But every time you go to the doctor, they take a measurement based upon what a blood pressure cuff or it's an automatic cuff. You know, when you go to Shoppers Drug Mart, you stick your arm. There's various blood pressure cuffs, and it gives us a diagnostic reading relative to what you are compared to the optimal. There are situations where blood pressure can be influenced. So does anyone here exercise vigorously? I am assuming you do, my friend. You look like your sleeves are barely containing those biceps. When you exercise, depending on the kind of exercise you do, you have a temporary spike in blood pressure if you exert yourself on a very, very high level. That is a normal physiological response to activity, which when flatlines back out, it actually can be beneficial long term. The emotional status, so when someone is severely anxious, someone is depressed, someone has some mental illness going on, or any kind of emotional stressor, for lack of a better description, that can affect our blood pressure temporarily while the stressor is present. Ideally, if that stressor becomes a thing of the past, your blood pressure should return to normal. But if it's a chronic thing, emotional stress can end up affecting our physiological state. So that's something that we need to think about as well. So the first number is the top. So say we have, this is said to be ideal. Top number is the systolic. What that refers to is that's the pressure exerted when the heart contracts. So the heart pumps blood around our circulatory system. So I'm going to, you know what? I can't, that's a heart. I failed art, I apologize. So let's oversimplify this. Whenever there is a contraction of heart muscle, it sends blood from the heart throughout the circulatory system. The bottom number, which is the diastolic pressure, is when the heart is relaxed. So there's always a relative amount of pressure because the force of contraction causes a constant pressure of blood going to our system, or else we would not have blood traveling to internal organs. But the two numbers are somewhat indicative of health status. There is a condition where you can have a normal diastolic pressure, but if your systolic blood pressure is very, very high, that could be an indicator of potential angina or arterial clotting of the arteries close to the heart. So that's something to always think about when you get your reading. Just because one of your numbers is in the ideal context, it doesn't mean that you're out of the woods. We have various stages of hypertension. Hypertension is a synonym for high blood pressure. So 120/80 being ideal, and we have various stages. Now, not everyone is the same. We all have different physiology. We all have different abilities to operate in what I call homeostasis. Homeostasis meaning a nice equilibrium point for us as individuals. I would imagine that some people have a slightly elevated or slightly depressed blood pressure, which is their normal. So if you guys are 121/81, you don't need to freak out. It doesn't need to be absolutely perfect. But when we're getting into stage 2 and hypertensive emergency, that is someone who's primed for something like a myocardial infarction or a stroke, something of that nature. So if you have chronically high blood pressure, they're warning bells. Imagine there's a red light flickering with a siren blazing at the same time. It's indicating that something is going on. However, we don't know when that something might happen. So these numbers are diagnostics to compare yourself to a relative ideal, and it's always good to get your blood pressure done every so often just to make sure that your numbers aren't changing, or if they are, maybe you can take some preventative action once you have the information. So what causes hypertension? It's a very, very multifactorial approach. What I have done is I have divided it into the sections that relate to specific lifestyle contributors. We have a couple physiological things that can cause blood pressure to change. So I'm a visual learner, so I'm going to try to do the same with people in the room who are visual. And for those who are auditory, I will try to explain it the best as possible. So that is my rudimentary drawing of an artery. If we have an increase in blood volume, but we have a hose or a pipe that is only so wide, what happens, I'm going to poll you guys, what happens when you back up a hose? Has anyone ever pinched off a hose with the water on? What happens? Pressure increases, so there's a temporary deformation of the hose until you return the pressure to normal. If you have extra water or extra fluid flowing through the tube, what's going to happen to a tube that's meant to encase a certain amount of fluid, right? Extra blood volume, which actually happens sometimes when people gain excessive weight because adipose tissue, body fat, actually needs a blood supply to deliver stuff to it. So if we have more supply needed, we're going to have more blood volume created, and that's going to cause an increase in pressure. The other thing that we can look at is nose lines mean stiffness. Stiff capillaries. So if the capillaries get very, very rigid due to things like oxidative damage or the improper ratio of antioxidants to free radicals from diet, they don't have the ability to expand because there is an elastic layer underneath the muscular layer within our, over top of the muscular layer within our arteries. And if they can't expand to deal with changes in pressure, then the hose size will remain constant and there will be no ability to adjust for increase or decrease pressure, like when someone exercises. They have always warned you, if you have high blood pressure and you exercise vigorously, be careful about how much you exert yourself. That's likely the reason why that happens. And the last thing is if you have stiffer red blood cells, we can actually affect the shape and the density of our red blood cells based upon the nutrients we put into our system. Now, unfortunately, there's no way to diagnose these with a test in terms of things like stiffer capillaries or white blood cells. But what can end up happening is if we're missing the necessary precursors, key vitamins and minerals and antioxidants for making proper healthy cells and proper red blood cells, we're going to alter the flow and the dynamics of what the blood vessels experience. From a dietary standpoint, high carbohydrate consumption, I apologize about the light and the font. I made it as black as I could, but it doesn't show up too well. High carbohydrate consumption causes an insulin spike. Insulin drives inflammation, especially in the arterial walls. So when there's constant inflammation in conjunction with flow-related inflammation, that's going to exacerbate the situation. Sugar also alters the ratio of sodium potassium in our blood because if we have an excessively high blood sugar, that causes the kidneys to imbalance water retention. Excessive caffeine consumption. Anyone want to take a guess why caffeine might alter blood pressure temporarily? Stimulatory effects. So caffeine actually triggers a small release of adrenaline and our central nervous system function gets heightened. A byproduct of that is when we are in a fight or flight-like response, for example, when we're in danger, our blood pressure increases because we need to send as much as we can to peripheral organs. So we need force of contraction to make sure things like muscles get enough blood. When we chronically have excessive caffeine, it's almost like a small little buildup of stimulatory effects over a long period of time. And if someone's hypersensitive to caffeine, that's exacerbated. So if they're having excessive coffee and they can't wonder why their blood pressure always fluctuates, that might be a simple trick to actually balance them back out. The last thing, excessive alcohol consumption. I don't need to go into detail. It's pretty obvious. Alcohol in excessive amounts is very, very toxic to the body. Alcohol, ethanol being a poison to us. It can cause a lot of free radical-related degeneration of things like arterial cells, which are very, very susceptible to damage. And that's why things like heart disease and high cholesterol are so closely tied to people with hypertension. Nutritional status. So this is the stuff that I find most people like. When it comes to nutrients, the body has different needs based upon different areas. Different organs have a higher or lower concentration of nutrients. When we're talking about the blood and blood vessels specifically, it's really sodium and potassium that have a large influence in blood pressure. The reason being is when you have excessive sodium, you have deficiency of potassium and vice versa. Also, sodium has a very interrelated effect with water. So where salt goes, water goes, and vice versa. If you have an excessive sodium concentration in your blood, you kick potassium out, and then this way the kidneys can't filter and regulate water balance properly. So the typical sodium to potassium ratio should be 5 parts potassium to 1 part sodium in the diet. That's ideal according to Michael Murray, who writes a book called The Encyclopedia of Natural Medicine, which is one of the course texts in the course that I teach. The typical North American diet is closer to 2 to 1. So 2 parts potassium to 1 part sodium. As I said, when you have excessive sodium in the bloodstream, you alter water balance. When there's less water and there's more sodium, pressure is going to go up. What we look at typically from a fruit and vegetable standpoint from a ratio, and this is not across the board, this doesn't mean every fruit and vegetable, but on average, it's 50 times the potassium to 1 time the sodium. Naturally occurring sodium isn't enough concentration to allow our cells to utilize it, but when we have things like preserved foods or packaged foods that a lot of people eat in North America, one way that they can stay on the shelf so long is they have a ton of added sodium to them. Like we need 4,700 milligrams of potassium on average on a daily basis. If we're having almost 2,500 milligrams of sodium, that's going to kick out a lot of that potassium. Another nutrient that's really important is magnesium. Does anyone supplement with magnesium here? Magnesium is becoming like the go-to thing, the natural calms. A lot of people find that works really well before bed. Magnesium has a relaxatory effect on neurons in the body, but it also does the same thing with muscle. So calcium and magnesium, like sodium and potassium, are inversely related. When we have too much calcium and not enough magnesium, we sustain excessive contraction of a muscle. That's why if you have a muscular cramp, a lot of the times it's due to a magnesium deficiency. When we have excessive calcium in the body, calcium can harden and be deposited around the body. Magnesium stops that from happening, so we don't calcify tissues entirely. Magnesium is something that can be supplemented, and there's a ratio for magnesium supplement, which we'll get into the amount, but it's relatively 6 milligrams per kilogram of body weight if someone is experiencing hypertension.
A little bit about taking magnesium with or without food, if there's any difference?
That's a great question. So she asked about if it's good to take magnesium with or without food. Anytime you take a mineral, magnesium being a mineral, you need the presence of acid in order to ionize the mineral if you're having it from food. From supplementation, if it's a certain form of magnesium, my favorite is magnesium glycinate. So they take an amino acid and they stick it to a molecule of magnesium. That's more absorbable when there's no food present, but you still won't have the same ability to absorb a mineral without the presence of some protein and some hydrochloric acid. The only time that I believe it works really, really well is with the natural calm stuff, because they take a form of magnesium and they use citric acid. So the chemical reaction makes a magnesium citrate that apparently is very absorbable, empty stomach or not. I always recommend if you're taking a magnesium supplement with a tablet, or if you're taking it as a part of a multivitamin, do it with food, because it's going to get absorbed a lot better. Does that answer your question? So vitamin C is another important thing. Vitamin C is one of our master antioxidants, and it actually helps to support arterial health against free radical damage. Essential fatty acids. ALA refers to alpha-linolenic acid, which is omega-3. You can get that from flax seeds, chia seeds, hemp seeds. That's the plant version. And EPA, which is a converted metabolite of omega-3, which is from cold water fish or fish oil. Both of those have an anti-inflammatory effect on the body. The one thing with those essential fatty acids is they're very fragile, which is why you need a decent amount of antioxidants from the diet so they don't become rancid. The thing that they do in regards to the blood is when your platelets get sticky, so imagine we have blood flow here and you have a lot of platelets that aggregate together, they change the consistency of the blood, so they can actually make your blood thicker and more viscous. Has anyone here done any kind of physics training? What happens when a viscous, thick fluid gets pushed through a tube? It exerts more pressure. So if you have thicker blood, the blood doesn't flow as well. It's like pouring engine oil in the summer versus the winter. It's a lot thicker in the winter. Same kind of concept with the body when we have sticky platelets. And the last supplement in this chart right here is arginine, which is an amino acid. It's very important for nitric oxide production, which is an important precursor to energy metabolism. But the other thing it does is it relaxes smooth muscle. The smooth muscle is the one that is around things like our digestive tract, as well as our blood vessels. When we have constant contraction of smooth muscle, we can't flow things through properly. So it's relaxing and contracting based upon the demands of the body. From a lifestyle perspective, excessive stress, I would be comfortable in arguing that stress, unfortunately, in an excessive amount, in a negative context, has an effect over every cell in the body, regardless of what disease we're talking about. Unfortunately, we live in North America, which is not the most stress-free lifestyle. And managing it is actually an art. It's an art form. I myself try to do some meditation. When my life gets a little bit crazy, I try to carve out some time for myself. And I notice a difference when my stress surmounts and my sleep suffers than when I don't in my physical health. So the after diet, number 2 thing will be managing your lifestyle from a standpoint of how well you rest and how well you sleep. From a physiological perspective, excessive stress causes the same effect as caffeine, the stimulatory effect, because we become in fight or flight. So the blood vessels constrict a little bit as a response to things like adrenaline and cortisol release, and it alters the function of water balance. There's a hormone called aldosterone that the adrenals secrete. So when the adrenal glands are stressed out, they can't secrete hormones properly, and the level of aldosterone in our body gets altered, so we can't regulate how much water stays in versus goes out through the kidneys. Excessive body weight. I think this is pretty self-explanatory. It ties into we're talking about increased need for blood supply, but excess body weight has a link to every cardiovascular disease as well as dysfunctional disease of energy metabolism, be it type 2 diabetes, insulin resistance, hypoglycemia, because typically people who are excessively overweight have issues with energy metabolism. When you have issues with energy metabolism, you can't modulate blood sugar properly. So I'm sure you saw this in the last class, but that's what a normal, say that's an even line, that's what normal blood sugar should look like relative to when you eat a meal and then time in between a meal. Your body will respond with increasing blood sugar if it's gone too low for too long, providing you have the adequate nutrient stores. People with hypoglycemia or type 2 diabetes kind of do this depending on what they do. And the issue with this is when you're here, inflammation is constantly high. When inflammation is high in the arteries, we increase A, the level of pressure, B, the level of damage. So people with excessive body weight and hypertension, one of the best protocols that they can do is to lose weight, decrease the need for extra blood supply, and improve the body's ability to metabolize energy. There's a molecule called homocysteine. Has anyone ever heard of something called homocysteine or had their levels checked? So homocysteine is a toxic metabolite of something called methionine, which is an amino acid. The reason homocysteine is bad is because it can drive arterial inflammation in high doses. So the best protocol against managing your homocysteine levels are making sure you have enough B vitamins that are called methyl donators. Those happen to be vitamin B6, vitamin B12, folic acid, and there's a supplement called SAMe. It's it's like a 26 long letter name. I'm very bad at pronouncing it, but if you look for a supplement called SAMe, it also has a very good methyl donator. So if your homocysteine levels are high, you bring them back down and you can improve your production of glutathione within your cells. Insulin resistance, we talked about excessive circulating glucose can increase the concentrations of glucose in the blood, which will alter pressure. And smoking, unfortunately, people still do that these days. I really hope that cigarettes eventually become outlawed. But smoking has a high heavy metal content in it, specifically cadmium, sometimes lead. What those things do is they can, A, alter your blood pressure because nicotine has a stimulatory-like effect in the body. 2, they reduce antioxidant concentrations in the blood, which can cause excessive arterial damage. And the third one is when you intake a lot of heavy metals, they have to get deposited somewhere. They get deposited in kidney tubules, and what ends up happening is you decrease the kidney's ability to regulate water balance because there's an excessive concentration of things built up there. So people who smoke a lot have a very, very increased need for antioxidants to manage that. And heavy metal detoxification is important, but that's a tricky thing you don't just jump into. So I don't want to get down that road. Additional factors, high blood volume. So like we said before, more volume equals more pressure. Decreased volume of the arteries itself. So instead of more blood volume, when the arteries start to narrow and there's more blood supply, we increase a backlog. It's that hose analogy where you tighten up the pressure in one area based upon the fact that the structure is changing. Stiffer capillaries, thicker blood, and environmental influence. So those are the guys that typically have the most affinity for damaging the kidney's ability to function. Lead, cadmium, mercury, they deplete our antioxidant function, and they also drive inflammation. And metals concentrate in the kidneys is the worst thing. So I believe you can do something called the hair mineral analysis. It allows you to determine your levels of heavy metals, because heavy metals also displace other minerals in the body, like calcium, magnesium, and zinc, because on the periodic table, they're all under the same category of metals because they're a large atomic weight. I would recommend that people do a hair mineral analysis if you suspect you have blood pressure issues that you can't figure out the root cause of. Sometimes it's nice just to look at a little visual representation. So a healthy artery has all the layers intact. So you have the elastic layer, you have the smooth muscle layer, and you have the actual endothelial layer, which is the inner artery, which is it's one cell layer thick. So when those guys get damaged, the response by the body to try to patch the hole is pretty severe, which is why you start to build up thickness. So you can see if it's damaged, you get a hypertrophy of the muscular wall inside the endothelial cells, which is going to narrow blood volume. So automatically it's going to increase blood pressure. Over the course of time, you have fibrosis, so you have a changing of the structure of the tissues. And then once that narrows the actual capillary flow pathways, that's almost irreversible damage. So we need to figure out how we can prevent this from happening. So I got some current statistics up to date. Oh, come on, you can't see the second line. I promise you there's a light blue line there. Adam, so I'm going to try to represent this as best as possible. So that line we're looking at right there is for females. And believe it or not, before 2013, females actually had a higher occurrence statistically of high blood pressure compared to men. We typically are the ones who always are predicting heart attacks and all that. So it's an interesting dichotomy in the sense that women, although it's not spoken about as much, have typically had more issues with blood pressure management. Apparently, according to Stats Canada, because you can't see this properly, this guy jogs up, and in 2013, men actually overtook women in terms of issues with blood pressure. So the statistics are 17.7% of Canadians aged 12 and older, and it's crazy to think about they're polling people aged 12, have an issue with high blood pressure. 2013 was the first time that men actually outscored women, which is we don't want to win that race. You guys are doing better than we are right now. We have to be smarter. Men, don't want to talk for all because I can see this wonderful Stonehenge of bottles, and there's some protein shakes and green stuff. I love seeing this. I'm seeing this more and more at these open houses, but a lot of male clients I deal with are much slower to adopt change than female clients are. I don't know. I've been told I'm stubborn. Maybe that's a gender thing. Sorry, guys. I don't want to throw anyone under the bus. But it's just the central message here, unfortunately, is that things are not going the right way. They're going the wrong way. And we need to educate the general public about what it is they need to do from a prevention standpoint before things get too late. You can see that's the color it was supposed to be. So we're looking by age demographic, a decade apart. So obviously 12 to 34. Luckily speaking, you're young enough to manage the things that typically get thrown at you. University life, eating poorly, not sleeping enough. You can manage it while you're young. However, if those are lifestyle habits that you develop at a young age and you don't manage them as you get to your 40s, 50s, and 60s, that's when things usually show up. And people ask, how did I get here? Why me? What happened to me? You do a little bit of a memory recall about what's going on in the past. Like, oh, maybe that wasn't the best idea. And that's what I think we're seeing, is because unfortunately, 30, 40 years ago, this information was not relevant because it wasn't available. Now we're getting smarter as a general public, but having information and implementing information are not one and the same. And I think that's where people fall down, generally speaking, because it's not a lack of knowledge, it's a lack of knowledge of how to do it. You know that trans fats are bad for you. You know that white bread is not good for you. You know that you shouldn't be eating things that come out of a deep fryer. People still do it, but they don't understand the associated effects about, even if it's a small dose of poison, if that's given to you frequently enough, it's going to cause some things to happen that you might not want to, might not expect for. So people 75 and older, by percentage, so 32.6% of Canadians aged 18 and over are obese. This was interesting, just to tie in with our previous statistic, and had high blood pressure. Those who were not obese, only 15%, so they polled people who they classified as clinically obese versus not. Twice as many people had high blood pressure in those who were obese. So the link there alone is enough to just to make you think, okay, number one strike against reducing blood pressure is weight loss. making sure that you manage a healthy body weight. High blood pressure rates increase with age for both males and females. The highest rate of high blood pressure was in the 75 and older category, 50% of males and 53% of females, so 1 in 2. I don't know if anyone has ever spent time in a seniors residence or any kind of retirement home, but the food that they give people who live there is really not up to code. And I think that's one of the biggest things, because as a prevention, we can talk about diet, we can talk about nutrients, we can talk about herbals and botanicals. None of that is discussed with our aging population. And I think there's a huge opportunity for people nowadays to go and work with that population, because they want quality of life. Just because you're 75, it doesn't mean that you have to sit down and say, I'm just going to play cribbage and Monopoly for the rest of my days. People can go out. The 75 is what, the new 55? I hear that. There's these arbitrary comparisons that I hear. But I think it is really true, because we're living longer as a society, but I don't think our quality of life is better. So I see that as a huge opportunity for people who want to go into the field and start working with people who no one really thinks about, unfortunately. There's a little graphic representation. So this lighting is not really working for me. So I'm going to try to describe this. So turbulent blood flow, you can see the blood cells getting kind of topsy-turvy. And when there's an issue or an injury to the epithelial, the lining starts to get eroded away. And what happens there is you get a thickening of the tissues that are underneath that lining as a response to helping to manage the injury. But when we thicken something or we narrow a passageway, but we don't downregulate the pressure, we have an increase at that one spot. And that's where things like blood clots and things that relate to strokes and heart attacks actually happen, because it's usually one area in the body that is narrowing the flow of blood throughout. So depending on where it is, be it close to the brain or close to the heart, is what determines the aftermath of what happens. We have a medical model. So if anyone here is on one of these or knows someone who's on them, these are the typical drugs that the pharmaceutical companies manufacture. And you'll see that, yes, they do work. So calcium channel blockers, beta blockers. There is a hormone called angiotensin, sorry, a little dyslexic there. And what that does is it does influence how blood pressure is regulated. But what happens with them is nothing actually deals with prevention. It's all managing symptoms. I call it crisis management. In certain cases, they might be absolutely necessary, but ultimately they're not going to save you if you were to stop taking them tomorrow. And that's where we come in as practitioners or alternative healthcare specialists, because we can work synergistically with people on these medications. Hopefully, we can allow them to make the choice eventually to get off them without negative side effects. So ACE inhibitors, they allow blood vessels to widen, so they prevent the hormone that is closely tied to blood pressure regulation to take effect. AGO, I call them, 2 receptors, they block the blood vessels by relaxing the action of that hormone. Beta blockers work by blocking nerve and hormone signals to the heart and blood vessels, thus lowering blood pressure. So we're playing with some endocrine stuff there. Calcium channel blockers prevent calcium from going into the heart and blood vessel muscles. So that's that contraction-relaxation relationship. And finally, renin inhibitors are enzymes produced, and renin is an enzyme produced by your kidneys that starts the whole process of regulating up or down of your own blood pressure. This stops the renin from actually taking effect. I have 2 questions. Number 1, are there side effects to these? I haven't gone in depth with research on all of them, but there might be. Number 2, what happens when these don't work and we have no other alternative for people, right? So that's why this stuff becomes even more important. So I'm going to show you guys very, very briefly how the system works. I'm also going to draw a little schematic and oversimplify it just for visual representation. So the hormone that regulates blood pressure is a feedback loop between the kidneys, the livers, the adrenal glands, the pituitary gland, and the lungs. If the system is abnormally active, we can have excessive blood pressure. Usually what causes the system to be abnormally active is either a deficiency or an excess of nutrients, vitamin D being one of the most important things to manage how much influence it has on upregulating blood pressure. The system can be activated also for peripheral reasons. One, if there's a loss of blood volume. So if we have a severe cut or some kind of open wound and we're losing a lot of blood, in order to prevent the body from passing out, the body will upregulate pressure, because when we have no blood pressure, we go into shock and we pass out. That's one thing. if there's a drop in blood pressure, a lot of people who suffer from low blood pressure, who have severe adrenal fatigue, they just don't know it. So when you have severe adrenal fatigue and your blood pressure is too low, the body will try to adjust, almost like a thermostat in a house, and upregulate blood pressure to try to normalize function. And in alternative fashion, if you decrease the filtration in the kidneys of sodium chloride specifically, and potassium, you decrease the flow rate of blood, so the kidneys will upregulate the release of renin, which will cause you to increase blood pressure naturally. I so wish that would actually show up because you guys can't see anything there. I'm going to do my best to break this down as easily as possible. Let's say that horrible drawing is a kidney. And now we have the liver who comes into play because the liver is one that produces. I'm going to abbreviate to AGO. If you guys want the proper spelling, it's AGINOTSENIGON. So these guys will produce renin. And this will get converted to what's called AGO2. And then from here, you have hypothalamus, pituitary, arteries, and adrenals. How all this works essentially is that if this hormone takes effect at the hypothalamus, we upregulate our thirst method, or our thirst feedback system, which causes us to drink more or less water, which will change up or down blood pressure. The pituitary produces a hormone called ADH, which is antidiuretic hormone, which stops the body from secreting excessive water. So if you have excessive production or upregulation of this, both of those will increase blood pressure that way. The arteries, that will cause it to vasoconstrict. So if we narrow the passageway of the artery flow, we increase blood pressure because we haven't downregulated blood volume. And finally, the adrenals release aldosterone, which does cause the imbalance of water retention in the system, which will ultimately influence the amount of sodium and potassium we have in the blood. So this is a complex system that's going on at any one time within the body. And typically speaking, when people have either some kind of injury-related mediation of this or deficiency of vitamins and minerals, this system goes haywire. But the medical model is blocking renin, blocking this, or blocking this. So the action can't be taken. But my question is, well, what happens if you're on those medications and you actually need to be able to upregulate the system? It's a little tricky. Anyone have questions up to this point? We're doing all right? Okay, so considerations in practice. When I see someone with high blood pressure, this is what I ask myself, and I might ask them. So what caused the increase in blood pressure in the first place? I look at an intake history, so we have some diet, some lifestyle stuff. We have a process here called symptomatology, so we can base a decision on what the client walks in with from a standpoint of, I'm experiencing this, I have no blood flow to this area, I have shortness of breath. So you might be able to determine what the client has based upon the symptoms they're exhibiting, because what they might be thinking is the root cause might not always be. And I look at peripheral factors. Do they sleep? What kind of diet do they have? Do they have an outlet? Do they have a stressful family life? All these things matter. Some other things you might want to look at, is this a cause of another issue that the person's suffering from? Do they have high cholesterol? Is the high cholesterol causing a narrowing of the arteries, causing this to happen? Do they have issues with their heart? Is their heart not pumping efficiently? So these are all questions that as a practitioner, you start to ask because you need to be able to be a good problem solver. In this industry, the people who do the best job are the best puzzle solvers. And I always like to solve puzzles. That's probably why I got into this in the first place. What effects does it have on the body? So we have pressure in the endothelial cells. We have the heart that needs to contract more to make up for the fact that it can't pump blood around the body efficiently. And then all the tissues that require blood supply, what are they experiencing as a result of someone who has really, really high blood pressure? And then what are the tools we have to work with? We have dietary adjustments, so we can do a dietary intake of the client or the person who walks into us. We can do a therapeutic supplementation regime, so making sure that they have all the necessary base nutrients in their system to run the cells properly. We can use botanicals, so certain herbs actually help downregulate blood pressure, but there's also herbs that upregulate blood pressure, and you need to know the difference between the two, because you wouldn't want to give something like ginseng to a person who has high blood pressure in the first place. That might cause a nasty after effect. And what lifestyle modifications within our scope can we suggest to someone? So those are the 4 areas that we can actually affect. Associated risks that are most common or most prevalent with high blood pressure, obviously atherosclerosis. So there's a synergy between elevated blood pressure and stimuli to induce oxidative stress on the arterial walls. The negative effects are the body does try to patch it, but unfortunately we permanently change structure unless we change our lifestyles to allow our body to remove the levels of inflammation there. Aneurysm. Has anyone ever had a weak, what happens when you stretch a very stretchy substance out with a lot of pressure? What happens to the middle of that area? It ruptures. So an aneurysm is when excessive blood pressure or excessive blood flow and pressure interact with a weak area in the body. Typically speaking, aneurysms are common going up to the brain. So it's not a great visual representation, but that's what a model of an aneurysm would look like if there was a rupture in the lining of the endothelial cells based upon increased blood pressure and weak cells. And we hopefully can manage that by making or creating healthy cells. Heart damage, force of contraction required to pump blood around the body or the blood volume around the body can increase the chance of coronary disease developing. So the harder the heart works, the way I see it is our hearts are engineered with a certain number of beats in them. So if you upregulate your heart rate over a long period of time, we're going to use up those beats faster. That's why exercise is so good to prevent this, because exercise can lower our resting heart rate. Finally, stroke. Excessive pressure on the arteries can cause systemic purging of blood throughout the brain. So when we have a stroke, we have a loss of blood to the brain, and then if we have that in conjunction with an aneurysm, we can have blood leaking out into the space between the inner brain's membrane and the skull. And I know someone, unfortunately, who had a stroke, and she had blood that was seeping into her brain excessively, and the space between where her brain sat in relation to her skull widened out, and it put excessive pressure on her brain, and unfortunately, she's now no longer able to speak, operate with her own motor control. And I'm not saying that it was only due to something like high blood pressure, but if we know the peripheral factors of what someone might be experiencing, i.e. in conjunction with their other health conditions, we might be able to take some action before something like that is inevitable. Because those aren't diseases or actions that you can come back from. And that's what's really scary with people, because we're so fragile when we realize that we are human and that we can bleed and break very, very easily. So what do we do? This broccoli obviously has been to the gym. You guys probably have the same exercise routine. I'm sorry that I'm picking on. Do you mind? Is it okay? No, that's okay. I'm slightly afraid of you, so I'm just gonna, okay. Trying to make a friend here. So what we do from a nutrition standpoint, obviously, is we're going to assess someone's diet first and foremost. So what we want to do is, it's a multifactorial approach. First and foremost, we want to address weight management. Excessive body weight just means that the human that we're dealing with has an excessive energy storage ability and a deficient ability to burn that energy, because it's calories in, calories out matter, but it's also where those calories are coming from. So that's the foremost aspect of education that I work with people on, to take control of what they eat based upon how it responds to their body. Second would be nutrient density versus calorie density. Can anyone think about a very nutrient-dense food? Nutrients being vitamins, minerals, antioxidants. Kale. Kale is like the vegetable right now. Everyone likes kale. Kale has tons of different nutrients in it, but 1 cup of kale probably has about 25 calories. That's what I call nutrient density. If the ratio of nutrients are higher in relation to the amount of energy that's in it. Can someone think of a calorie-dense food? Avocados. So that would be an issue of where they're the same. It's nutrient-dense and calorie-dense. Can you think of a calorie-dense food that tastes really good that likely isn't very healthy for you? Cake, donuts, baked goods, chocolate bars, all these things. When there's not the necessary, nature packages nutrients in the calories that are synergistic to our ability to digest, absorb, and utilize them. Fortunately, white dough fried in sugar does not have any nutrients in it. It just has a ton of calories. So if someone's diet is predominantly fast food, artificially preserved, or fried, for lack of a better description, they're not getting any nutrition in their bodies. They're chronically hungry, but they're not chronically fed, is the way I look at that. A proper balance of micronutrients. I personally don't like individual nutrient supplementation long term unless you have a condition that needs it, something like iodine and thyroid health, for example. But that's why a good multivitamin and mineral complex, or a good complex geared specifically towards a specific condition, i.e. blood pressure, heart health, they have nutrients in a good ratio and profile like nature does. So if we're looking at supplementation and diet, we want the proper balance of nutrients and the proper profiles. We're looking at low glycemic stuff, so that relates to the little blood sugar model I talked about before. High glycemic carbohydrates increase our blood sugar's concentration very, very quickly, which causes an overproduction of insulin, an over experience of inflammation, and ultimately it promotes hypoglycemia happening. So if a client walks into you and they have issues with blood sugar and they're eating a very high glycemic diet, educating them on the negatives of that is a very, very important thing. And lastly, you want to look at anti-inflammatory diets. I'm sure that you guys have heard about this if you read Vitality magazine, all that. The dangers of inflammation. Most diseases or most conditions that we deal with are correlated or associated with inflammation. Dietary strategies to reduce inflammation can make a massive difference because the body can heal when there's no inflammation. So from a nutritional standpoint, high potassium diet, vegetables first, fruits is second. I don't think that fruits and vegetables are the same thing because fruits have a large content of sugar relative to vegetables. If you give a 3-year-old the choice between a strawberry and a Brussels sprout, I can tell you 10 times out of 10 what that kid's gonna pick, right? Because there's sugar in it. Now, if we have someone who's overweight and they're eating a lot of sugar in the form of fruit, thinking it's a healthy thing for them to do, it's better than sugar coming from an artificial or a processed source, but you still have to manage the amount of sugar. So that's why vegetables are always my first pick, followed by fruits second when it comes to plant-based foods. Celery, according to Dr. Michael Murray, who's a very well-known naturopath, is one of the best things for decreasing high blood pressure. According to him, 4 to 6 ribs, so individual stalks of celery per day, can have a 12 to 14% decrease on people with high blood pressure, both diastolic and systolic. There's a compound in there called 3N butyl sorry, how can I pronounce that? Butyl photothiolate. I have dyslexia issues, so if you guys could help me out here, I could actually appreciate that. I call it 3NB because that's way easier to pronounce. That is the component in celery that actually does the job at helping manage high blood sugar. The other thing that's really good is garlic and onions. Garlic and onions are sulfur-containing foods. So number one, they actually have a protective effect on our cells' well-being, especially things like essential fats. And they decrease stickiness of the blood, so they make the blood more viscous, number one. And two, they're also very antiparasitic and antibacterial. Now, I don't recommend if you want to make friends to be eating 2 cloves of raw garlic a day because no one's going to want to be in close proximity to you. But you can do this in a supplemental form because raw is better because there's a compound called allicin, ALLICIN, which is the active component in garlic that helps to manage blood pressure. So I've used that in conjunction with other things as an antibacterial approach, but also with people who have seriously high blood pressure, it does actually have a positive effect. I've used it in practice in conjunction with some other nutrients, and it's done really, really well. There's a really good product by Natural Factors. It's called Garlic Rich. That's the one I like the best because it has a high content of the active component, but the other ingredients, so the things that they have to put in the capsule, are very, very minimal. So you're not intaking magnesium stearate or any kind of machine-based lubricant like some supplements do. And then raw nuts and seeds and their oils, they are the best plant source of essential fatty acids. In order, my favorite happens to be flaxseed, chia seed, hemp seeds, walnuts, and then pumpkin seeds. Those are the concentrations from highest to least essential fats within the foods. So those are the ones that I promote people to eat, just keeping in mind that Nuts and seeds are very calorie dense, so if they are trying to lose weight, don't binge on them because 4 handfuls and you're about 350 calories, and that's a lot of energy for someone who doesn't actually need more energy. Cold water fish is a very, very good source of EPA, DHA. From what I've understood, you can actually assimilate the omega-3s in that much better than you can in fish oils because some fish oils are not, they're not what's called a triglyceride form. I don't know if you guys have ever researched any of this, but we intake dietary fats and we package fats in the body in the form of a triglyceride. A lot of fish oils, they have to be molecular distilled and then they have to be taken apart and reassembled. Only the better quality products, from my understanding, Nutrici and Nordic Naturals, repackage them as a triglyceride. The others are called ethyl esters, so they're a different molecular compound altogether than a triglyceride, and our body doesn't have a good ability to utilize that in high concentrations. So you might be taking 5 grams of fish oil, I would have no idea how much you're actually utilizing. So it might be an expensive waste of money, unfortunately. So triglyceride fish oil is the best, or eating cold water fish that's wild caught 3 to 4 times a week. If you're sick of salmon, you can do lake trout. That's also a fatty fish. The smaller the fish, the less concentrations of toxicity, so they say, because unfortunately our oceans are contaminated these days. So if you know that it's either responsibly fished from a different part of the world where it might not be so contaminated, or if it's a pristine lake, that's the best thing. I usually go to Nature's Emporium. Have you guys heard of that place? It's a grocery store called Nature's Emporium. They have one in Newmarket and they now have one in Vaughan. And they have a really interesting strategies. They partner with sustainable fishermen only. So they don't have a lot of selection most of the time, but what they do have is really, really fresh and it's caught sustainably and they don't bring in a ton of it, so there's not a lot of waste. So right now they have salmon, they have lake trout, and they have some sole. Generally speaking, fish that people eat a lot of the time. Reduce excessive animal proteins. Animal protein that has a lot of fat, saturated fat specifically, can be pro-inflammatory. And I say can because it doesn't mean automatically. A lot of the research in the last few years has actually shown that saturated fat isn't the problem. The problem fats are the ones that come from toxic vegetable oils, so things like corn oil, canola, what's another one, safflower, peanut oil, because it doesn't matter where they come from, they all end up looking, tasting, smelling the same because they get deodorized and they get heated and they end up being very toxic to our cells because our body can't do anything with putrefied fats. Those and saturated fats excessively, so imbalanced with the essential guys from either fish or plants, nuts, and seeds, throws off our ability to manage inflammation. So when we have excessive saturated or excessive oxidized fats, number one, we don't make cells properly, so the cells don't function the same. Number two, we can't mediate inflammation because we need essential fats to manage things called prostaglandins, which are directly relating to either up or down regulating inflammatory response. An example would be if you rolled your ankle and your ankle swelled up, that's a good inflammatory response because that's the first sign of healing. Chronic low-grade inflammation that has no outward symptoms, things that are tied to things like cardiovascular disease, you might not be able to see it because we can't heal it. But we can't heal it, it shows up one day in the form of needing a quadruple bypass. So that's why essential fats and the balance of saturated versus unsaturated fats are so important in our diet. As a society, I think we're fat phobic. We're afraid of eating too much of it. So my suggestion there is embrace the healthy fats. If you're getting at least a good tablespoon or 2 of good plant oils a day, 1 serving of nuts or seeds, and a lot of leafy greens, that is the best thing you can do from balancing out your good your good anti-inflammatory fats to your negative pro-inflammatory fats. Synergistically, leafy greens and legumes are very good as well because they have a high content of potassium, magnesium, fiber, which manages blood sugar, and flavonoid-rich foods. Flavonoids are a form of antioxidant that helps manage our free radical load because when free radicals run loose in things like arteries and epithelial cells, they can induce a lot of damage. And if we don't have the necessary antioxidants to neutralize them, that damage builds up over the course of time. So I have 3 diets that I think are most effective when dealing with high blood pressure. First, I'm sure you've all heard of the Mediterranean diet. Mediterranean diet is great because it's high in the good oils. So you have a lot of olive oils, you have nuts and seeds, You have things like hemp oils. You have low glycemic carbs, so it's not a lot of grains. Yes, the Mediterraneans do eat breads, but they make their own, so they stone ground their own grains. And the wheat in Europe is typically different than the wheat in North America. When I go to Europe, I can eat bread. Here, slice or two and I'm done. So I just avoid it at all costs. The other thing about the Mediterranean diet is it's moderate protein, moderate fruit, high vegetable. So it's a good balance of protein, not excessive sugar, lots of micronutrients. There is one diet that's specifically formulated for people with hypertension. It's called the DASH diet. So it's a dietary approach to stop hypersensitivity. The premise behind this is they increase the specific nutrients that are really important for managing blood pressure, as well as increasing nutrient density and high fiber. So it's similar to the Mediterranean diet. It's just a little bit more specialized. And the last diet, I don't like to use this name because it's not the most accurate thing in the world, but the paleo diet. Everyone's heard of the paleo diet. The paleo diet is good because it manages insulin, it reduces the amount of carbohydrates, it gets rid of the carbohydrates that are really not health promoting for the body, and it increases the protein content. I think some paleo people get a little carried away with meat. They have, 18-ounce steaks for dinner with a side of vegetables and say, okay, but that's something that if you do the paleo diet well, some people thrive on it, they feel great. I personally feel better when I go that route. But you have to do your education to figure out what the paleo diet is and how it works for you. Because, again, each of us has their own biochemical individuality as humans. Your genetics are different than mine, or different than this gentleman's, different than yours. So we each have a specific need, and we know what suits us best typically by feel. So I'd always educate everyone, if you're going to try some dietary changes out, journal or keep a log of how you feel. And then if you do some diagnostic testing at the doctor, for example, get a blood test done, do a blood pressure score, see how these changes might affect you, because information is always better when it comes to making decisions. So individual nutrients, we're looking at potassium as a supplement if someone has an imbalanced ratio of sodium to potassium. Now, in consideration, if someone has kidney disease, or as we age, we don't have the ability to filter out potassium and sodium as well. So it is possible to excessively build up potassium in the blood and displace sodium too much. And we can't balance our fluid ratios if one or the other is too high. More potassium is better than excessive sodium, but it is a consideration if you are supplementing with potassium or using something like a potassium salt that you don't go crazy with it. I prefer doing the dietary standpoint of choosing foods that are higher in potassium than I do then shaking potassium salt on your food excessively. Potassium-rich foods, again, better, I'm gonna put this. People go crazy with supplementation sometimes, and it's really, really important to know what happens when you have a deficiency and a toxicity, because there's two sides to the coin. Automatically taking a supplement doesn't mean it's automatically good. A little bit of poison is still a poison. Although most supplements are safe in higher doses, some things like vitamin D, vitamin A, vitamin E have an upper limit, and the upper limit is actually not health promoting. So if you are doing the potassium thing, use it as part of a formula, or, like I said, err on the side of food. Magnesium is another one. So according to Dr. Michael Murray, 6 to 10 milligrams per kilogram of magnesium a day is the upper limit of what you want to do. So to find your weight in kilograms, you simply divide your weight poundage by 2.2, and you multiply that by 6 to 10 milligrams. That's a good starting point. I like magnesium glycinate. It's my favorite. Magnesium citrate would be my next favorite because they're more absorbable. There are other forms of magnesium like magnesium oxide. Those in high concentrations will give you a bowel cleanse. So you got to know what kind of magnesium you're buying before you start to increase the dosage that much, because again, not every supplement is the same.
Which two did you say were superior?
Glycinate and citrate. There is one called magnesium malate as well. Those are 3 of the more absorbable forms. Unless you're doing some kind of bowel detox, avoid magnesium oxide in high doses though. They actually market a product for that specifically, and it purges everything. So if that's your goal, that's okay, but I don't think you're going to have a good Saturday afternoon if that's your plan of action. Methyl donators, so we talked about these before. Methyl donators are very important for managing your level of homocysteine in the body, specifically in the blood. B6, B12, folic acid, SAM-E, which is not up there, and one called trimethylglycine. You can get these in a supplemental product. Then there's another really good product I like by AOR. It's a company that makes advanced B complex. These B vitamins are already what I'm going to call metabolized form, so the body doesn't have to metabolize them, so the absorbability is very high. And because they are water-soluble vitamins, except for B12, whatever you use in excess just gets excreted by the body via urine. So the dosage of the vitamins isn't quite so crucial in terms of not going over the edge. You have a fail-safe. It's not a fat-soluble vitamin, which can actually concentrate in tissues. And then arginine. I gotta have one caveat with arginine. If anyone is susceptible to cold sores, do not take high doses of supplemental arginine on its own because it can aggravate the herpes simplex virus. So if you do not struggle with that, that is okay. You can utilize arginine to improve nitric oxide production. But if you do suffer from cold sores, I will just saying, Roland said be careful because they do aggravate cold sore production. And if that's the case, you want to utilize some lysine. Fiber is a very, very important, I think, underutilized supplement for most people. People who don't get enough fiber typically don't have absolutely ideal bowel habits. So from a standpoint of not vacating waste material, fiber can help manage blood sugar because fiber is an indigestible carbohydrate, which slows the entry of glucose into cells. So if someone is experiencing issues with their blood sugar, adding supplemental fiber, I think there's one called PGX. Have you guys heard of PGX? It actually works really, really well because as soon as PGX interacts with water, it expands like tenfold. So it actually fills the area of your stomach up in conjunction with what you eat more so you're actually less hungry. I think Dr. Michael Murray also did the reason I reference him is he's the principal guy who we use as far as information in the course that I teach. He did a study where he, on himself, using PGX on a regular basis, he lost weight to see if it actually helped with his hunger, but that was a byproduct of managing his hunger, is that he lost weight. So people who are trying to lose weight due to hypertension, this is a great thing you can give them because PGX isn't like a psyllium husk. It's not an insoluble fiber. People who have dietary issues or bowel habit issues, large amounts of insoluble fiber can really aggravate them and cause a lot of digestive disturbances. It's a soluble fiber. When it interacts with water, expands, and it can be soothing to the tissues of the digestive tract as well. I also like flaxseed, ground up flax seeds for two reasons. Number one, high dose of essential fatty acids. Two, there's tons of fiber in them. And all the carbohydrates in flax seeds are pretty much fiber, meaning you're not going to net any carbohydrates at the end of the day. If you do flaxseed though, grind your flax seeds from fresh. Don't buy pre-ground flaxseed because it's very susceptible to oxidization if it's not sealed in a bag, if it's not kept away from heat, or if it's exposed to light. You don't know how old it is too, right? They say the best before date, they don't say the date of manufacture typically. So you might be buying old flaxseed, which you don't want to tamper with essential fats like that. Coenzyme Q10 is very, very important for antioxidant protection in the heart specifically. If anyone takes a statin drug, statins block the manufacture of cholesterol, but they also block the manufacture of coenzyme Q10. The reason coenzyme Q10 is so important is because it has an affinity specifically for the heart. If someone has hypertension, their heart's going to be under additional stress, likely needing more antioxidants. There are two kinds of Q10. If you go into the health food store, you'll see one called ubiquine and one called ubiquinol. Ubiquinol is the better form because it is more easily utilized by the body, but it's also about 3 times as expensive. A bottle of ubiquine might be around $20, ubiquinol might be around $55, $60, comparatively speaking. But with supplements, a lot of the time you get what you pay for. So if you are going to go down the route of using supplemental Q10, go with the ubiquinol brand or the ubiquinol kind. I believe Flora makes a good one. Natural Factors makes a good one. Innovite makes a good one. I should ask you all the questions. Awesome. So there are a lot of good companies out there. If you go into a good health food store and you have a knowledgeable rep there, they can educate you on the specific details. Typically speaking, people above the age of 25 can utilize both of them, whereas if you're older than that, you have a hard time utilizing the ubiquine for coenzyme Q10 supplementation. Finally, vitamin D. Low vitamin D has been associated with a ton of risks. People who have blood pressure control issues, this regulatory system right here is very closely tied to vitamin D status. So right now, being the weather is, although cold, the sun is out, I always recommend for people, get outside in the smallest amount of clothing you're comfortable with wearing and just get in the sun for about 10, 15 minutes. It's free. It's free vitamin D. It's also the best way to do it. In the wintertime, making sure you're supplementing with vitamin D3 as opposed to D2 is important because we can't utilize or synthesize D2 properly. I say always start at minimum 2,000 IUs a day. I don't think that's enough. Depending on the condition, I've seen as high as 10 to 20,000 IUs a day, but those are specific conditions. I think anywhere between 2,000 to 5,000 IUs a day is probably a good starting point from October to roughly March. If you spend a lot of time working outside in the summer, you can actually store vitamin D for a period of time. However, those stores do run out the more we need it, or the more requirement we have for it. So vitamin D is really important. There are some botanicals, 2 things that have been shown to be beneficial for hypertension. One is hawthorn. So hawthorn has vasodilative properties, the opposite of vasoconstriction. So it actually dilates the blood vessel according to according to the literature saying the high antioxidants of the proanthocyanidins relax blood vessels. So it has a similar effect to what magnesium does into the body. And olive leaf. Olive leaf acts as a natural calcium channel blocker. Excessive calcium, deficiency of magnesium causes excessive contraction of muscles. The reason I threw AOR up there is they have a great line. In no way, shape, or form am I affiliated with them, but they have really good quality products. There are other professional lines that you can look at. Pure Encapsulations, Cytomatrix, Douglas Labs, they're all really good quality products. I'm a bit of a snob when it comes to buying supplements because I want to make sure that I'm getting the best quality and concentration of what I'm purchasing. If someone is coming into you, do not let them have licorice, ephedra, or Panax ginseng. Those are 3 botanicals that can actually increase blood pressure, along with caffeine. So if someone is taking an adrenal support, for example, a lot of adrenal supports have Panax ginseng and licorice in them. So make sure that you're reading the labels of what's in them to make sure that those, A, are not in high quantities. B, if they are there, make sure the person has clearance from a natural health practitioner to use them.
How about ashwagandha?
From my knowledge, I don't believe ashwagandha increases blood pressure. It is an adaptogenic herb, meaning that it does help the body recover from stressful situations. But as far as this goes, I don't believe it interacts. But I would always suggest that if you're going to look at something like that, do a lot of research beforehand, because some people it works well for, some people not so much. So it's really important to know all the facts before you make a decision like that. And then we're looking at some lifestyle stuff. So number 1 is stress reduction. Deep breathing is probably a good place to start. Deep breathing can oxygenate the blood well. Look at people who breathe like through the chest. They don't get full diaphragmatic action of their circulatory system. So deep breathing exercises, just closing your eyes and relaxing, are one of the easiest and best things you can do if you find that you're anxious, which likely means you have excessively high blood pressure. Meditation is something that I've recently got into. I don't know if anyone's ever tried meditation. It's really hard because you close your eyes like, oh, okay, I'm gonna breathe. What do I want for lunch today? And you do say this is conversation you have with yourself so a little bit of meditation is better than none at all. Don't get frustrated with meditation. Give it a chance. There's really cool meditation apps on smartphones nowadays. Headspace, yeah, it's awesome. There's one called Stop, Breathe, and Think. Headspace is great because it's guided. So there's actually, you don't have to think.
Voice is just amazing. Like, it's just
Soothing English accents are always good for meditation. That's the long and the short of this. But it's great because when you purchase the whole app, you can have guided meditations for whatever you want them to be. So you can actually specialize your meditation based upon what lifestyle factors might be influencing you at the moment. Stop, Breathe, and Think is another one, or meditation courses like weekend workshops of learning. There's one I know that's Awakening the Illuminated Heart. That's one that I'm actually going to hopefully do sooner than later, and it teaches you how to enter into your own body and meditate through being inside of yourself, which I think is the whole goal of meditation, being alone and mindful with your own thoughts and your own feelings. And then proper sleep. The easiest, best thing you can do for yourself as a human is go to sleep before 11 p.m. at night. The reason it gets dark and it gets light at specific times of day are to influence our natural circadian rhythms. But we blunt them by looking at TV screens, computers, smartphones. All these lights emit what's called blue light. And blue light stops the release of melatonin from your pineal gland, which stops us from getting ready to go to bed. So it's a cycle interrupter or a cycle dysregulator. I always recommend to people, if you're going to get into bed at, say, 10 o'clock, but you can't fall asleep, read a book. Do not start scrolling through YouTube or seeing what Facebook is telling you. That's going to be the worst thing for you because you're going to find yourself very, very alert and stimulated after looking at a computer screen for a couple hours. Proper sleep also helps regenerate. We rest and we regenerate cells when we sleep. So it's a very important thing to make sure that we get enough of it and we sleep before midnight, before 11 is best if possible. The last thing we'll talk about is exercise a little bit. I have a bias just based on the fact this is part of what I do for a living. We have two kinds of exercise. There's aerobic exercise, which people typically refer to as cardio, which is kind of steady state. I'm going to do treadmill, elliptical, biking stuff. And then we have anaerobic, which is more along the lines of resistance training, weightlifting. They're both good for us. They have different effects on the body. But both have been shown in many studies to lower blood pressure because they improve our body's efficiency of using our circulatory system. With aerobic exercise, you actually improve or increase the size of the ventricles in your heart, meaning you can store more blood volume, so you end up pumping more blood volume per stroke. Why that's good is it actually lowers your resting heart rate, meaning your body works more efficiently to pump blood around the body without actually overstressing your heart. That's why cardiovascular exercise is good. Anything above 20 to 30 minutes, typically speaking, at a steady state, is enough to give you that kind of effect to change the size of the ventricles in your heart. Anaerobic exercise is actually one that temporarily increases blood pressure when we're training because the demand for blood, locally speaking, in a muscle is very, very high. The reason that is good, though, is number one, when we anaerobically train, we improve our insulin sensitivity, meaning we have a better ability to utilize carbohydrates as fuel, better ability to store them if we have more muscle tissue, and less likelihood of storing them as body fat because excessive sugars in the body get converted to body fat. The second thing that this does is anaerobic exercise hypertrophies the heart muscle itself, meaning you can have a more forceful contraction and pump more blood volume around. So providing someone doesn't have excessively narrowed arteries, this is a very good thing because the heart is stronger when you do anaerobic exercise and the heart is more efficient when you do aerobic exercise. So those are the two things that we want to focus on from a lifestyle perspective with exercise. So I have spoken enough. I'm going to take a moment and let everyone have the dust settle. And now I want to know about what you guys have to talk about or what you guys want to know.